Okay, we're going to go ahead and get started this morning. I want to welcome you all for joining us. Welcome to the VillageReach webinar, Do Drones Deliver? My name is Jennifer Crouch. I'm the Development Director here at VillageReach, and we're really glad to have so many people joining us from all across the world. I'm sure that we'll see more people log on as the morning goes on. Today, we will be talking with Olivier Defawe, who leads the VillageReach Drones for Health program, Luciana Maxim, who is Senior Manager on the VillageReach Evidence and Learning team and the Drones for Health team, and Hamadou Dicko from Gavi, the Vaccine Alliance. Olivier and Luciana will share VillageReach's experience with drones, also known as unmanned aerial systems. And then we'll talk with Hamadou about Gavi's interest in the sector. Hamadou, Luciana, and Olivier, welcome. Thanks for joining us today. We're really happy that you're here. The last portion of the webinar will be reserved for questions from you in the audience. Though you will be muted during the presentation, you can submit questions at any time through the chat icon at the bottom of your screen. And during that final portion of the webinar, during Q&A, I will direct the panel to answer your questions. So we're going to get started in just a moment, but just briefly, I'd like to share some background on VillageReach for those of you who may not know us very well. We were founded 20 years ago to create a world where each person has the healthcare they need to thrive. VillageReach works to transform healthcare delivery to reach everyone when, where, and how they need it. Our solutions help increase access to quality healthcare for more than 35 million people in sub-Saharan Africa, and Drones for Health is one of our most exciting new innovations. So we're very excited to share that with you today. To maximize our impact, VillageReach focuses on 3 aspects of the health system: health workers, access to products, and data systems. We support health workers so they can provide quality care to their patients. We help deliver vaccines and medicines to the last mile so people have access to the treatment they need. And we focus on data-driven decisions at all levels of the health system because we believe that smart decisions lead to improved health. So from our start in Mozambique, we now also have offices in Malawi and in the Democratic of Congo, which we'll be referring to as DRC today during this presentation. And as you can see from this map, we also work in many other countries through our partner organizations who help us to implement VillageReach solutions. So that's just a bit of background on VillageReach to help frame your understanding of who we are. And now I'm really pleased to turn this over to my colleagues, Olivier and Luciana, who will tell you a little bit more about our Drones for Health program. Olivier, we're ready for you.
Sorry, I was on mute, obviously. Okay. Good morning, good afternoon, or good evening, everyone. So last August, Luciana and I were in Wijifake. Wijifake is a village in the middle of the Equator province in the Democratic Republic of Congo, to demonstrate that even the most remote communities can receive the vaccine and the medicine they deserve as human beings if people are willing to embrace change and leverage new solutions like the use of drones. This drone flight demonstration was a culmination of months of collaborative effort on the ground between the expanded program of immunization of the Ministry of Health and VillageReach. One of the most amazing experiences in my life was watching the drones land in front of us and seeing children running from all directions to witness this happening. As you can see, this drone is fairly large with a 7-foot wingspan, so it's pretty impressive. And you can imagine the excitement from the community seeing for the very first time, right there in the middle of DR Congo, what appears to them as a mechanical bird or a mini airplane. The drone's use belongs to Swoop Aero, an Australian drone service provider with whom we have been partnering with. It's not easy to get to Wijifake Health area. The roads are rough and often become impassable during rains. Our own vehicle got stuck on the way to the village, and it took a group of many people to push it out. And this is not at all uncommon. Wijifake is also completely cut off in terms of modern means of communication. There is no cell phone reception, and thus no way to request products in advance unless someone physically travel to Mandaka, the provincial health office, which is only about 45 kilometers away, but an actual 3+ hour journey. So clearly, it is incredibly difficult to get vaccine and medicine to Wijifake routinely, and especially impossible to do it quickly. And this is a common challenge in many areas of the world where emergency responsiveness is also not typically an option. There is no 911 to call, no ambulance, no emergency personnel. So something like a snake bite or postpartum bleeding is tremendously dangerous. In these places, drones have a huge potential to change how we reach people who currently aren't getting the healthcare they need, when and how they need it. With drone, we envision a world where a health worker can make a call and an antivenom or some blood batch can be quickly flown to them, saving lives. So in this picture, in green, you have Emmanuel. Emmanuel is the head nurse and his colleague in white. Every time the clinic needs vaccine or medicine, he or his colleague have a 6-hour round trip on those road, the road that you just saw. In addition, in order to get a resupply of product, Emmanuel has to pay out of his own pocket for the trip and spend time away from the health center, which means times away from patients in the community. You can imagine that under this condition, Emmanuel often runs out of vaccine and medicine, which means that kids don't get immunized, which put their life at risk. Vaccines save millions of lives a year, but only if they are available. So in order to meet our goal to transform healthcare delivery to reach everyone, we need to find better ways to make sure the medicine and the vaccine they need are available when they need them. So drones are one of the biggest opportunities in cracking this rural healthcare delivery challenge. Talk about drones has been used for the last few years. It's all over the news and the potential is clear. Even FedEx, UPS, Zipline, and even Walgreens are all vying to solve this problem because they see that drones have the potential to provide an affordable, quick, and responsive delivery system. Amazon says that it's going to be able to drop pizza boxes on my doorstep. Well, that's great, but what we really need, what we really want, is the potential to leverage this technology to save lives. And this is why over the last few years, VillageReach has been testing, actually since 2016, we're testing the use of drone to solve both the routine and emergency delivery challenges. In 2017, for example, VillageReach started testing the drone in Malawi to deliver blood for transfusion and oxytocin for maternal health emergencies. During this project, we work with 2 drone companies, and both have had challenges, 2 technical challenges due to radio frequency interference issue. But these challenges gave us the opportunity to learn, and we are now applying this learning to subsequent projects where we are currently conducting, like the one in DRC. One of the things we learned was that we need an autonomous drone that could connect directly to satellites to avoid that interference, and that we also need to have a lot of pre-test, initial test flight before any official demonstration flight. We also knew that we wanted a drone that could do two-way transport and being able to land at facilities in remote location and collect lab samples, for example, and bring them back where the sample can be tested. This ability to deliver and pick up health products is a key requirement that ministers of health in the various countries where we work have called for to improve the delivery of health services and not just the delivery of products. In DR Congo, we choose to work with Superior following a global request for proposal and a rigorous selection process that involve independent aviation experts and the DRC Civil Aviation Authority. In addition to working at the community, at the country level, VillageReach is also playing a key role at the international level by leading the UAV for Payload Delivery Working Group, which consists of a community of over 250 stakeholders that are directly or indirectly involved with the development and the advancement of the drone technology in the health sector. The community meets for roundtable discussion, thematic webinar. We produce a monthly newsletter with the latest in the space, and we host an extensive resource library, all with the hope to promote collaborations and accelerate the development of drones for delivering health product. We believe that it is important to share our learnings widely because we think this technology has so much promise for global health and across the sector. Now, my colleague Luciana will talk in more detail about the recent drone demonstration in the Democratic Republic of Congo. Luciana?
Thank you, Olivier, and hello, everyone. Are you able to hear me?
Yes, we are. We can hear you.
Our Gavi-funded drone project took place in DRC, and I just wanted to point out to everyone, this is one of the largest countries in the world. Specifically, our project was in Equator province, which is also a very large area. Just to give you a sense of size, if we compare it with other settings that have had drone projects recently, this province is about the same size of the entire country of Malawi and 4 times the size of Rwanda. So as we think ahead at expanding the intervention in DRC, we're looking at a much, much larger scale of operation. Because of the size of Equator, the population is largely dispersed in remote rural areas, divided by the Congo River and many other bodies of water, and by dense equatorial forest. This combined with the state of the roads and telecommunications infrastructure that Olivier mentioned, make Equator logistically very challenging. As a result, supply chain performance historically has been poor, with high rates of both stockouts and overstocks of health products. In early 2017, VillageReach began working on supply chain challenges in Equator through a partnership with the DRC Ministry of Health. The program is called La Nouvelle Génération de la Chaîne d'Approvisionnement, or NGCA in French, which translates into Next Generation Supply Chains in English. The key innovation in the NGCA is delivering health products directly to the health facilities. This supports health workers because they don't have the burden of leaving the health facility to go get the health products that they need. Drones for us fall under the broader umbrella of NGCA, as we believe they could be a faster, more effective, and less costly way of delivering immunization and other health products directly to rural health centers. Drones could also bring back product receipt forms, orders, inventory reports, eliminating the need for health center workers to travel away from their site and patients. So when we started our phase 1 project in late 2018, DRC had very limited experience with autonomous drones. There was one project, I think, in the agriculture sector using drones and one in the mining sector and none at all in the health sector. In early 2019, so this year, VillageReach and the Ministry of Health conducted focus group discussions and individual interviews to help us understand perceptions about drones. We spoke to about 100 stakeholders at the national, provincial, community levels, and learned that while they showed very little familiarity with drones, there was high acceptability for the idea of medical drone deliveries once that idea was introduced. Once we established interest, we realized we needed to raise awareness and also prove feasibility. To do that, we focused on multiple interventions aimed at governance, aviation and health regulations, technology, and acceptability. We found that engaging government agencies was particularly important. For example, our team in DRC worked with the Ministry of Health to establish a multi-sectoral National Drones for Health Commission and a provincial drones working group that observed the drone flights, helped organize all the project activities, and ultimately made the decision to scale up the intervention. DRC's Civil Aviation Authority provided approvals for the drone company that we partnered with, Supaero, for the flight plans and routes and for importing the drones. And the Ministry of Health, with the expanded program on immunization, or EPI, helped determine the quantities of vaccines and syringes to send to 5 health areas around Wijifake. They also supported in creating the standard operation procedures for transport of this product by drone and determined the data to be collected and helped acclimate the communities to the drones. So earlier, Olivier spoke about rural Wijifake, which participated in the drone flights in July and August. And from everyone's perspective that we spoke with, the flights were a success. Here are some of our key results. We started with a day of test flights over the Congo River, but quickly moved to flights in populated areas. Over 5 days, 2 of Supaero's drones completed 50 drone flights. That's 25 round trips from EPI's vaccine distribution center in Mbandaka, the capital of Equateur, to Wijifake Health Center, covering a total distance of 2,000 kilometers in the air in just 20 flight hours. Each round trip was about 80 kilometers. The drones flew at an average speed of 115 kilometers an hour, and this reduced transport time significantly from 3 hours to about 20 minutes one way. In total, we distributed just over 25 kilograms of health products, mainly vaccines and syringes. That's enough to last for 2 months, plus 1 month of buffer, and to immunize 470 children in the 5 rural health areas around Wijifake. And during the demonstration flights that we had in August, 7 babies were immunized. They were the first children in Central Africa to receive vaccines delivered by drones. On 5 of those flights, we also delivered essential medicines and supplies, some that were completely stocked out at the health center. And on 1 return flight, the Wijifake nurse sent blood lab samples to be tested for yellow fever and measles. And on all return flights, product receipt forms showing the condition and temperature of the vaccines were immediately sent back to EPI. What was also exciting for us is that in just a short period of time, EPI and health center staff quickly became trained in packaging the products, loading and unloading the drone, collaborating with Supaero's drone pilots in sending the drone up in the air, educating the community member on safe takeoff and landing, and exchanging product orders, reports, and even letters by drone. Supaero also flew 2 drones at the same time in opposite directions, showing government officials that there's quick potential for scalability. Overall, this demonstrated that drones can become part of a routine and responsive health delivery system, and we're able to respond to immediate needs on the ground. So what did we learn during this 12 months phase 1 project? If there is no prior experience with drones in a region, it is important to understand stakeholder awareness and perceptions, both positive and negative. In our case, by talking to stakeholders, we're able to conduct customized outreach activities that prepared community members prior to the drone flights taking place. We also learned that public and private partnerships are critical. In our case, there are several government agencies and ministries involved, along with Supaero, the private drone company. VillageReach served as the connector and overall project manager, but our team was quite small on the ground, and we mainly worked through the Ministry of Health, national and provincial teams. All players together showed that it is possible to have a successful collaboration for a brand new project like this. We also learned that a phased rollout is important to address technological, regulatory, or feasibility issues before the stakes become too high. And we had to be ready to respond quickly, both to challenges and successes. For example, one of the challenges is that DRC does not yet have national regulations for drones. So it took months and months for the government to identify civil aviation as the ultimate authority that would approve the project. One way we helped to develop their confidence and comfort with drones was to involve civil aviation in the selection of the drone company and have them directly observe and guide the flights. And now that the demonstration has been proven successful, the government and communities have high expectations for continued routine drone deliveries. So what is next? What I just described was phase 1 of a longer project, and VillageReach is currently planning and fundraising for phase 2 in collaboration with the DRC Ministry of Health. In early 2020, we aim to begin 12 months of routine drone deliveries of vaccines and other health products in Equator province. As we said earlier, Equator is quite large, so this will be significant scaling. Right now, as we speak, we have 3 teams of provincial Ministry of Health personnel that are traveling to the most remote areas of the province to assess and validate a list of 25 health centers where the drones will fly to. These are health centers with refrigeration, so they will also serve as storage sites for neighboring health centers. Beyond distribution, our goals for phase 2 are to build local capacity for drone operations by training local health workers and supply chain staff to use cargo drones, and to continue to generate data and evidence on the impact of drones on supply chain performance and also costs. Phase 3, this would be a long-term implementation starting in 2021 without an end date, allowing the Ministry of Health to expand to additional provinces, additional settings, for example, urban areas like Kinshasa, the capital of DRC, to expand to additional medicines and health products and use cases, for example, emergency product deliveries. VillageReach also hopes that success in DRC can be replicated in some of the other countries that we work in, including Mozambique and Malawi. And we're currently testing drones in Mozambique for TB lab sample transport. Thank you, Olivier, and back to you.
Thank you, Luciana. This is a very, very exciting time. We've done a lot, but there's so much ahead of us. And to continue this webinar, we are really pleased to have an opportunity to bring into the discussion Hamadou Dicko from Gavi. Gavi, who is the institution who supported this phase 1 in partnership with the Gates Foundation. Hamadou, are you there? Can you hear us?
Yes, I can hear you, Olivier, loud and clear.
Wonderful, wonderful. So maybe, I'm not sure if everybody is aware of what is Gavi and the Gavi Vaccine Alliance. So can you take just a couple minutes just to give a short background on what Gavi Vaccine Alliance is, just to as background?
Thank you, Olivier. Thank you for inviting the Gavi Vaccine Alliance for joining this important webinar. So I'm Hamadou Dicko, work with the Gavi Alliance in the Health System and Immunization Strengthening Unit. Gavi is an international organization that was created in 2000 to provide access to new and underutilized vaccines. And so our mission goal is very simple, is that we believe that we have to continue saving children's life and protecting people's health by increasing equitable use of vaccine in the lower income countries. And how do we do that? So since 2000, we have supported currently 17 antigens or 17 vaccines, so which have led to avert about 13 million future deaths and to immunize more than 760 million children, at least in the Gavi eligible countries. We started with 73, now there are 68 countries that we support. So we invest along with countries about more than $1 billion per year on vaccines. But not only do we procure vaccines along with those countries, but we also provide health system grants of about $250 million a year to help those governments to reinforce the health system. So in a nutshell, so that's what Gavi does. But since our inception, we have been at the full part of innovation, and that's why we've been very much interested in trying to see how can the Gavi Alliance as a whole, which is comprised of WHO, UNICEF, the Bill and Melinda Gates Foundation, and of course the Gavi Secretary based in Geneva, how can we play a role in this, in helping countries to adopt these new technologies that we believe are going to have an impact on children and women and childbearing age. Over to you, Olivier.
Thank you. Thank you, Hamadou. This is a good overall background. So a follow-up question. You started, started talking about it, but could you expand on why did Gavi, your institution, decided to support VillageReach and VillageReach for this phase 1 of this drone program in DR Congo for delivering vaccine? So why VillageReach? Why for the drone program in DRC?
Well, thank you, Olivier. I think that your slide showed that the topography on DRC, we believe a couple months ago that this is a country whereby we can see a contribution of drones into improving the availability of commodities at the point of delivery. So we had actually requests from the government to support drone and to have discussion with villages. So this shows not only Gavi, but also the government of DRC recognize the value added of VillageReach since its inception almost 20 years ago, I believe, and working in last mile and others, but being at the forefront of technology. So it was a win-win situation for us. So the government recognized VillageReach as a key implementer, as a key entity in this innovation world, especially towards the last mile using drone. And we, the Gavi Secretary, also recognizing VillageReach as a key partner for our immunization supply chain and especially around the last mile delivery system. So we chose VillageReach because of the reputation VillageReach had in country. We chose to support VillageReach to provide the resources for VillageReach to support the government of DRC it's also in the Equator region whereby access is complicated. And we believe that if you are able to bring the commodities at the health center, that we contribute to about 50 to 60% of the issue, the rest being on the demand side. But that's why we selected VillageReach, because of the recognition of the government of DRC of VillageReach value added. And also from our secretarial viewpoint, VillageReach being a key partner in the immunization world, but also in the innovation world, especially on the drone. So that's how we decided to support the DRC and VillageReach, because we believe DRC is a key country whereby if a drone can make a difference, it will make a big difference in DRC, and VillageReach was the right partner to help us undertake this exercise. Over to you.
Thank you, Hamadou. Yeah, like you mentioned and like Luciana mentioned, the drone project in DRC falls under this next generation supply chain program, which is a program in partnership with the government to explore innovative ways for delivering to the last mile. and the drone, I want to make sure that everybody understands, drones are not there to replace the existing mean of transport that the government is already using. It's an additional mode of transportation to help reach the area, the communities that it is hard or costly to reach with the existing mode of transportation. So it really falls within a global effort to look at innovation to improve last mile delivery, drone being only one solution among others that VillageReach is testing in DRC. Now, we heard, I'm sure if you keep track a little bit of drone and what's going on in the world, there is a lot of discussion, there is a lot happening, a lot of small, I would say small scale implementation, the type of implementation that lasts a week, a month, maybe a couple months, but also very deployment that is very small in terms of geographic scale. And that's normal, in when you try to develop a solution, you got to show that it's feasible, safe, and scale progressively. So I'd like to have your opinion, Hamadou, about, okay, now we know drone can be safe, drone can be used it's feasible to use drone to deliver and keep the quality of the product and so on. So from your perspective, Hamadou, what will have to happen for drones to really become part of a solution to this global health challenge, but in the long run? What will have to happen in this area beyond those demonstration or small scale implementation?
Thank you, Olivier. I think that's a very good question. I think at least for us, Gavi Alliance and our partners, we see drone, as you mentioned, as an integrated part of the immunization supply chain and of any supply chain, contributing to improve the availability of commodities at the point of care. So I think we have had a lot of pilots that have come, and in our case in DRC, really thanks to the approach that we have developed, making sure that for each step we have the right policy in place, that we have the documentation, we have the approval, and that we are able to demonstrate. I think going next scale, I think for us it is to see how can we bring this now to maturity, and meaning that how can we collectively integrate this as part of routine immunization and our contribution towards primary healthcare. I think that will be key. We need to generate evidence, but I think evidence as we generate, I think we need resources. We need to scale up our project in DRC and to showcase how this is done, not in one province that is the size of a country, but how can we scale it up nationwide where there is a need and demonstrate the value added as you've seen in terms of reduction in speed and time spent in travel, environmental friendly, and some other elements that are required. Missed opportunity due to lack of vaccine availability when the guardian and then the child comes and there's no vaccine because it has been raining and people cannot go and get vaccine. So I think we need a coalition on this, and we, the Secretariat, are really looking as part of, as you know, in this to seek partners come on board, assist us, assist villages, assist the drone community. How can we move beyond small pilots to scale up? And we believe that we have an opportunity in DRC whereby the government is willing, the partners are coming out, and we have the right partner in country being VillageReach leading this and demonstrated the result that was presented. And we think that we just need to come and scale this up. And I think we need resources, but we also need the right entity to help. We need the policy to change, and we need the mentality to be ready. So in a nutshell, I don't think so if I have answered correctly your question, but I think in DRC we have all the ingredients that are there. All we need now is to secure the resources to generate more evidence, integrate this as part of routine immunization, as part of primary healthcare, scale it up. And I think if you are able to do this in DRC, we will be able to scale this up anywhere that we can. But we need to move beyond pilots to bring to maturity and to focus our resources and bring this to scale. Over.
Yeah, no, well said, Hamadou. And this is a journey that VillageReach started with this phase 1. Now the phase 2, which is progressive scale up, both in terms of geography as well in terms of time. There is no, actually, so far there is no implementation of drone use of drone over just a few months, with the exception of zipline, with zipline being its own, it's a different business case. But 12 months, if we are able to do this phase 2, 12 months of routine and emergency delivery would definitely move towards that scale, that need to scale, like you mentioned, Hamadou. Thank you for that. So, Jen, I don't know if, I think we should let people ask the question. I mean, I'm going to pass the microphone to you.
We have actually a lot of questions that have come up during the conversation. So some of them the group may have answered to a certain extent, but I think that there's some room for elaboration. So I'm just going to give them to you all in the order that they were received. Olivier, when you were speaking, the question was about, you were speaking about areas that lack cell phone service. So in these regions of the DRC, the question is, there's still a delay of getting medicines even with drones, correct? Or do they just do healthcare forecasting and then the drones come every week or in some routine manner?
So that's a very, very good point. So we are looking at using drone for both the routine delivery and the emergency delivery. When it's routine, it will be based on consumption data that'll be provided to the provincial level to plan the next redistribution cycle. For the emergency, obviously, you need a way of communication. And with the deployment of the drone service that we are planning, we will have a way to communicate via satellite. So we are looking into, in addition of deploying those drone service, also associating that with communication capabilities through satellite, because the drone is dependent on satellite due to the fact that there is no cell reception, so we cannot even use the 3G for connectivity with the drone. We're using satellite, so it wouldn't be it wouldn't be a big stretch to also deploy some kind of communication via satellite to allow health workers to call for emergency distribution. So that is something that we will be deploying as part of phase 2 as well.
Great. Can either Luciana or Olivier, one of you, speak a little bit about the payload? So when we were talking about the demonstration flights, we said that we had 50 flights, 25 kilograms were delivered. Can we extrapolate that that means there's a 500-gram payload? Is that correct, or what is the payload?
I'm happy to take this one, Olivier. So with Super Aero's drones, there is a maximum of 3 kg payload per flight. Because vaccines are tiny and syringes are very light, bulky but very light, they never quite went beyond 1.5 kgs. So it became more of an issue of space in the drone, of volume, than weight. But we did prove 2 kgs, and the distance does not matter with Super Aero's technology. So you can go far with 1 kg or 2 kg or 3 kg, up to 3 kg. The nice thing about Super Aero is that they use 3D printers to build their drones and to build parts. And they were already able, because of that, to quickly respond to a request from the Ministry of Health in DRC, where the EPI said, can you increase the volume for phase 2 because we have all these syringes that are bulky, and they already more than doubled the volume since August. They redesigned their drone quickly. So the new drone that would be deployed in phase 2 would allow double the volume to be carried. 50 flights, the way we count them, because Super Aero can land at the facility, we count each way as a flight. So I think I mentioned that's the equivalent of 25 round trips. So it's about 1 kg, 25 kg is about 1 kg on average that we delivered per flight.
Great. And I think what you pointed out was something I was going to ask you all about. If no one had said anything, it's really amazing. I think that a piece of this solution is that the drones can be fixed through 3D printing. Is that correct? That there will be 3D printers available so that they don't have to go back to Australia for repair?
Yes, that is part of the budget, yes.
And you get to see this also for the impact on potential impact on the economy and the employment. So what we're thinking is the solution needs to be sustainable. So we do not want to rely on a company in Australia to send the spare parts and things like that. No, every operation needs to be operated in country by locals. And so, the idea is also to develop a business plan and a business model to make that solution sustainable. One of them is to assure the maintenance and the support for assuring the drone operation, which means we will have staff, local staff, not VillageReach staff, but government staff, or private sector, local private sector will be in charge of assuring the maintenance and producing those spare parts using 3D printer on site or in Ecuador.
That's pretty fantastic. One of the next questions, I think that this would be interesting to hear both the perspective from VillageReach and also from Gavi. Questions about what are the risks involved in this project. So I think if we could speak to that on a couple of levels, maybe like the logistical risks, but also what are the, what are the larger risks involved in a project like this?
Yeah, I can start if you want, Hamadou. One of the risks that we've been talking with the government and partners is the sustainability of such a solution. It's one thing, demonstrating for a week, a month. The next phase here is like 12 months of operation. And one of the risks is that once the donors, the money from the outside is not coming in, this is gonna fade out. This is why VillageReach, and that's what we're doing in Mozambique too. We are, from the very beginning, developing a transition plan to try to limit the dependencies from the outside donor by involving from the very beginning the different Ministry of Health, it's obvious, but the Ministry of Finance, Ministry of Communication, and start looking at the application of this solution beyond just health to make sure that we develop a business model that would allow the sustainability of that solution. So that's one of the key, and even more when you work in an area like in DRC, which is very complex, this is a risk that is bring up and that we have to deal with from the very beginning. Hamadou, I don't know if you have some additional comments on this.
No, Olivier, I think that you've captured. I think the challenge is with any donor-driven support in terms of resources is the sustainability. I think that's the biggest risk I see in this. It is the sustainability piece. Of course, some may mention about the security risks associated, but we haven't had any experience of that, at least in DRC. But the sustainability, how do we make sure that these costs are going to be borne by the government, and I believe that we have a mitigation approach into this, which hopefully we will look into the phase 2 and phase 3. How can we ensure that slowly that there is a plan to make sure that these costs are transferred? As Olivier mentioned, so we are starting with the end in mind. If we are successful, how do we want the government to take? And I think the examples of VillageReach actually undertaking those type of exercises now in different countries are going to be beneficial. But the greatest risk is sustainability, as with any other project. Over.
That's a really good segue to the next question, and both of you brought this up, I think, in some respects. What is the cost sharing for the flights? Does the government / Ministry of Health pay, or is donor funding needed? And I think you could expand upon that just to say in general, like what is the financial and operational relationship with the government around this project?
Yeah. It's a very great question. You can imagine that for this phase 1, it was a smaller scale. that was purely donor funded, that was Gavi funded. However, the Ministry of Health did put some of his staff time to this project. So that's already a start. For this phase 2, which is 12 months of operation, more and more the government not only going to be dedicating some staff, but also is going to dedicate some funding directly, like the EPI, the Expanded Program of Immunization, is actually allocated some funding that they are getting from all the different program partners dedicated to drone. They actually will be dedicated some cash, some actual funding to that program. Last, the objective, one of the objectives of the phase 2 is to identify the partner, potentially the public, the private partner, and develop a public-partner partnership and a semi-independent structure to take on after phase 2. So one of the objectives of this phase 2 is really to think about how can we make this financially sustainable, and how can the government and the private sector can work together to develop this business, which will allow both the private sector and the public sector benefit from that partnership. The public sector being ongoing operation, and the private sector having some business incentive for them. So we are already discussing with a few private partner, international, who are in DRC, as well as local private partner, and we're going to be exploring what a business could look like, a partnership, public-private partnership for the business sustainability. One last comment is that for this phase 2, as you can imagine, you were 12 months of operation. We're thinking about probably having 6-7 drones. So it's kind of a big undertaking. So the cost is much higher. And so VillageReach with partners, we've been doing a lot of fundraising, because this is definitely a bigger cost than the demonstration cost. And so we are developing a coalition of funders and partners and donors, public and private, to all share the cost of that 12 months of operation. And so we are in this phase of fundraising for developing that coalition of funders.
Great. So there were some questions that I'm going to come back to them, but I want to skip over them for just a moment, because I think that there's a couple that go together. Luciana, when you were talking about the time that it elapsed in order to get to the stage where health workers were prepared and ready to do this work on their own, you spoke to the fact that that was really an exciting piece of it, was seeing how rapidly the uptake happened. So can you speak a little bit about what was required, like how long did it take to capacitate health workers on operating the drones, and what was required in order to get them to that level?
Sure. It was truly an exciting finding, because one of the things we wanted to find out is how feasible would this technology be in the settings that we're working in. So yes, it's a great technology, but can we actually implement it, and can the local Ministry of Health staff work with it? So of course, SUPAERO maintained control of the flights, because it's quite, you need a certified drone pilot for that, and civil aviation was very clear on that. But everything else around the drone operations was done by the Ministry of Health, so the EPI staff at the Vaccine Distribution Center in Bandaka, and then at the other end by the health center personnel, starting with the nurse in charge and the rest of the staff. So it was really learning by doing, and it really just took a couple of days. It was not very complicated. Part of what we tried to do is make sure we don't change practices and procedures. So we worked with the Ministry of Health on trying as much as possible to follow standard procedures for transport. We used the same product delivery and receipt forms for completion. Packaging, just slightly adapted. I saw a question from Nagesh. Nice to have you on, Nagesh. For vaccines, we used 2 ice packs in each of the styrofoam boxes that Supaero designed according to WHO standards and size. And so we tried to maintain cold chain for the vaccines. We obviously didn't have to do that for the syringes. We had no problems maintaining cold chain. I have some nice graphs we can share with you. So really, they were doing the work that they normally do, but it was quite exciting, I think, for them as well. And within a couple of days, they were doing everything on their own.
Can I share an experience that was kind of fantastic? So I was sitting at the Wijifake, so the rural health center, and so I stayed there for the 3 first day of the demo, and I felt I was just sitting there doing absolutely, well, nothing in terms of actually interacting with the drone. The health worker were just doing all the work, and I thought it was like so amazing that after a couple days of practices, they were able to handle all the operation of unloading, reloading, sending the drone back, and that we were there for safety and just to make sure everything was right. But I thought it was just amazing that this technology, this amazing technology, we're in the middle of nowhere, literally nowhere in the middle of Equator province. And there's like this operation is happening without outside major intervention. I thought it was just amazing. It was just an experience that was just amazing, I thought. Sorry, I just wanted to share that.
No, I'm glad you did. One of the things that we talked about when we were preparing for this webinar is that both Olivier and Luciana, you both cautioned me against giving the impression that this was, that this event was the thing, when in fact it was the last stop in many, many months and even years of preparation, that so much had gone into getting us to this stage, to this very exciting day. So I think that, a lot of what you're speaking about, sitting there and watching people be able to do this work, came about because of the forethought that had gone into it. And one of the things that I'm really curious about is that you showed a picture early on of children around the drone touching it, and you spoke about kids kind of coming from everywhere to see this. What does it look like to prepare a community for this new kind of technology? What had to be done in advance?
Luciana, you want to take that one, or either way?
Sure, and we haven't dedicated a whole lot of time during this presentation on the process itself and everything that went into the project. But as you said, Jen, the flights were really the culmination of all the work. So we started with obviously several meetings of both the National Drones for Health Commission and the Provincial Drones for Health Working Group. And I just want to point out that we, from VillageReach side, we only have 2 colleagues that actually live and work in Ecuador, and a small team of colleagues in Kinshasa, and then a couple of us who supported from the US side of things. So really the Ministry of Health got very, very involved. And so they organized themselves, and then with our support and technical assistance, we conducted a stakeholder perception study. Then we organized the initial test flights with onlookers from the communities. Then we worked with the Ministry of Health on an in-depth community outreach strategy. We had a radio campaign, we had press campaign. We had people go door to door to explain what the drones were, how to take precautions, benefits, risks. Why is this such an exciting innovation and opportunity to maybe help the communities? And so this all happened before the flights even took place in August. So there's quite a bit of it, but we really do want to give the credit that is deserved to the Ministry of Health, who was very, very involved in every aspect of the operations.
That's great. Thank you both. You already saw and noted Nagesh's question about temperature control and spoke to the ice packs. So we answered that question. There's a couple more that I'm hoping we can get in before the end of the webinar. One is, what are the cost-benefit thresholds in terms of travel time, payload value, for example?
So right now, it's only theory. There is a lot of modeling, theoretical modeling exercise that's been done. You can imagine by running small scale, both time and on geography, it limits your ability to really punch off the cost, the actual cost of operation, and therefore really evaluating the impact on the cost, on the supply chain performance, and so on. And that is exactly why this phase 2, and this phase 2, which is going to be an entire province, which is a big territory for a minimum of 12 months of operation, one of the key objectives is to actually generate that data, that evidence on cost, on supply chain performance, and health impact or health system impact. Right now, this, there is publication, but it's all based on a lot of assumptions. And this DRC phase 2 is going to be one of the first study that will be actually being able to generate that evidence because of the length of the operation and the scale, geographical scale of that operation.
Thank you. Sadly, I don't know if, do you think you'd be able to answer this in 1 minute or less? Are there any lessons learned from drone delivery programs in other Gavi-supported countries that could be applied in DRC or have been applied in DRC?
Hamadou, you want to answer that one, or?
Yeah, I can quickly try. I think that this is a country whereby we are using our own resources to support this drone, and there may be other projects that are coming in the pipeline. But we've seen that from inside the Gavi Secretariat using Gavi resources, this is one whereby we have invested upon the request of the government and VillageReach Technical Aid to invest our resources on this. Of course, we've been supporting, as you know, Rwanda through UPS and Zipline, and soon we will be seeing. But this is one of the projects whereby we have invested heavily. Over, Olivier.
Yeah, and maybe to complement, the Gavi actually, Gavi is supporting Zipline. We are in contact with Zipline to learn from their own experience. So this is the only one that I'm aware of that Gavi is supporting beside the DRC one. Now, we are leveraging the experience of other partners, and that's what the UAV for Payload Delivery Working Group is really key, is to share that learning that from Madagascar, from UNICEF in Malawi, and from PSM Chemonix in Malawi. We are all talking through that working group to really share that experience and try to avoid repeating mistake or things that didn't challenge us, avoiding repeating those challenges and using the solution. I hope that answered quickly.
I think so. Thank you. I want to thank particularly Hamadou for joining us today, but also Luciana and Olivier for that great presentation. Really enjoyed the discussion. Hope that those attending did as well. So that brings our program today to a close. Sorry for a couple of technology issues we had there, but we hope you'll stay connected to VillageReach. If you haven't already, please visit our website, villagereach.org. You can sign up for our newsletter there on the bottom left so that you can stay current with what we've got going on. Thanks again to our panelists. Thanks to all of you for joining us, and we hope that you have a great day or evening no matter where you are in the world. Thank you.
Thank you.
Thank you, everyone.